What a day it was on health care reform. With the clock ticking loudly, the Democrats in Congress threatened to unleash a rule rarely used on Capitol Hill. Republicans said the legislative equivalent of a card trick. What is it? Let's bring in our congressional watchdog. If it's a card trick, Jon Karl, is it a trump card?
Well, I'd call it a wild card, Diane, and we don't know if they're going to play it yet, but it is already added to the political firestorm over health care.
Outside the Capitol, opponents rallied for one last fight against the health care bill. Inside, Democrats were pressing hard for votes. But today, controversy over a measure Democrats say they may use to push a bill through.
We will do what is necessary to pass a health care bill to improve quality, lower cost, and make America healthier.
Last year, they thought that you could pass a bill without having to read it. This year, they want us to pass a bill without having to vote on it.
What they're talking about is a procedure called deeming. It can be found in Volume 6, Chapter 21 of Deshler's Precedents. This is the rule book for Congress.
The procedure allows members to vote on one bill while automatically deeming another is also passed. In this case, the House would vote on a fix-it measure that would make changes to the Senate health care bill, and then, in the process, automatically pass the Senate bill without actually voting on it. It's a procedure that's been used about 20 times over the last 30 years by both Democrats and Republicans, but never on legislation as seismic as health care reform. Speaker Pelosi says what matters is the final product.
If you want to talk about process, let's talk about the process that the insurance companies use. When they say to you, you become sick, your insurance is canceled.
Republicans call it a sleight of hand, even unconstitutional. And one undecided Democrat told ABC News he doesn't like it either.
I think if we do it through rule gimmickry, that's going to hurt the perception that's out there.
And without winning over undecided Democrats, the bill won't pass regardless of what procedural maneuvers are used.
Some of the heavy lifting today was done by the president himself. White House officials say that he had one-on-one meetings with a handful of those undecided Democrats at the White House, where officials say, Diane, they are increasingly optimistic that they will get the votes to pass health care.
And every day a new drama. Jon Karl, thank you.